Thank you all so much for joining me today for this recorded version of Approaching and Sustaining Weight Loss Maintenance. My name's Rose, and I'll be your presenter today. Just a few reminders before we dive into the presentation. This is meant to be an interactive experience, so grab something to jot down some notes with and answer some of the discussion questions that we have throughout the presentation. If you have any questions after today's presentation, be sure to reach out to your care team. Your dietitian can always hop in the chat to answer your nutrition questions. Always remember that you are the expert on you, and there is no one-size-fits-all approach when it comes to nutrition. This information is intended to serve as a general guide today, not as an individualized prescription. Also keep in mind that this is a no judgment zone, and all foods are good foods. There will be a survey at the end of this presentation, and we appreciate your feedback. A little bit about me. I'm Rose. I'm a registered and licensed dietitian. I did my undergraduate in nutrition at Middle Tennessee State University, just outside of Nashville, and then I moved to Baltimore to complete my dietetic internship with Johns Hopkins Medicine. In my free time, I like to hang out with my cat and crochet. My nutrition approach is to meet you where you are, then bolster you with the tools and confidence needed to take the next best action for you. My goal is to create a judgment-free zone, provide evidence-based and personalized nutrition advice, and guide you to set and achieve attainable and sustainable goals that nourish your mind, your body, and your life. So, when talking about weight maintenance, I think it's important to discuss weight loss expectations and safe pace of weight loss. With a typical diet and exercise program, someone can expect to lose between 5 to 8% of their starting body weight over the course of a year. So, for someone starting at 300 pounds, this would typically look like 15 to 24 pounds over 1 year. Someone taking generic medications like bupropion and naltrexone, for example, could expect to lose between 18 to 21 pounds over 1 year, versus metformin could expect to lose around 3 to 12 pounds over 1 year with a starting weight of 300 pounds. The GLP-1s, you definitely start to see some higher weight loss ranges. So someone taking Ozempic may expect to lose 18 to 21 pounds over 1 year, or Wegovy 42 to 45 pounds, and then Zepbound and Mounjaro with the highest percentage, 20 to 22%, or 60 to 66 pounds with a starting weight of 300 pounds. So, weight loss expectations vary from medication to medication or with more traditional diet and exercise programs. It's also important to think about what a safe pace or rate of weight loss looks like. So, on a GLP-1, we look for about a half to 1% of your starting body weight per week. So, for someone starting at 300 pounds, this would mean we would be looking for around 1.5 to 3 pounds per week. We start getting concerned for muscle and bone loss or considering weight loss too fast if you're losing greater than 4 to 6% of your starting weight over the course of 1 month. So for someone starting at a weight of 300 pounds, if they were losing 12 to 18 pounds, their care team would definitely be reaching out to them and seeing if we needed to adjust medication or talk with a dietitian about side effects or whatever is going on that's causing that accelerated weight loss. So you might be wondering, well, what's my goal weight or what's the right weight for me to sit in a maintenance phase at? This is something that's completely unique to you and your body, and there's not one particular weight range or BMI range that we're looking for. So Weight Watchers Clinic is not going to let you aim for a BMI of less than 22, but other than that, your goal is entirely up to you and what's going to feel best. Try to think about things other than traditional kind of BMI range or what normal weights would mean for you, as this isn't always healthy for you or sustainable for you. Choosing a goal weight, start thinking about how your body is responding to the medication, what's realistic for you, such as how much attention to diet and exercise would you like to sustain long term? Where do you feel your best? Is there a certain weight that you feel confident at, that your clothes fit better, or you have less pain? And where do you feel like your lifestyle is the most sustainable, livable, and flexible? I always recommend finding a range, maybe 5 to 10 pounds around your goal weight, and this could be considered your maintenance weight range. As people, things happen, our bodies are not machines. And so small fluctuations in weight are completely normal through time, even for someone maintaining their weight. So finding that range that you're comfortable with makes your maintenance phase more livable and flexible. Also, thinking about goals that are not necessarily related to that number on the scale. Like I was saying a little bit earlier, what are some of the wins that you've experienced or would like to experience as you move through this journey? These are some great examples of what we would consider to be non scale victories, and sometimes these feel better than the number on the scale. Have you noticed more energy? Have you noticed your clothes fitting better? Maybe you're able to run around more with your kids in the yard or lift a heavier weight. Are you having better sleep or feeling less inflamed? Maybe your blood sugars or your blood pressures have been looking better. Just overall improved quality of life. Maybe you're feeling more confident. Your digestion could be improved, or maybe you're preventing some of those chronic diseases from developing, like type 2 diabetes. So pause the video and think about what's your biggest non-scale related win so far, or what are some non-scale wins that you're hoping to achieve? Approaching your weight maintenance phase can be really exciting, but it also can feel overwhelming to a lot of different members, especially if there's someone who has struggled to maintain progress before. Knowing that you're not alone, we see weight regain with all different types of weight loss journeys, whether it's a typical intensive lifestyle program without a medication, bariatric surgery, or even a GLP-1 program. So let's talk about what the research says. This study looked at participants after 1 year within a lifestyle program, so diet and exercise plan. At 1 year, 28% of the participants lost greater than 10% of their starting weight. On average, participants regained 1/3 of lost weight within 1 year of discontinuing the program, and half of participants returned to their original weight within 5 years following the program. Bariatric surgery, we also see this recent systematic review demonstrating that 49% of patients regained weight after bariatric surgery, and about 20 to 25% of the weight initially lost after surgery was regained. So if someone lost 100 pounds, they would usually regain around 25 pounds over the 10 years post op. You're probably wondering what weight regain evidence looks like with GLP-1s. So let's look at this trial following participants over 1 year after stopping a subcutaneous semaglutide injection paired with lifestyle intervention. So, after medication was stopped, as well as the lifestyle interventions, participants regained 2/3 of their prior weight loss and also experienced similar changes in variables like cholesterol and triglycerides. So, you can see on the graph there where medication was started over a 68-week treatment phase. The blue line shows the participants on the semaglutide and lifestyle intervention program. Then, after medication was stopped, we can see that line start to trend up, demonstrating weight regain over 1 year. So, based on that study, you might be wondering, is GLP-1 then a lifelong therapy? Thinking about how it's been portrayed in the media, it can be kind of frustrating to think about GLP-1s as this quick fix and then look at this evidence. Think about some of the other chronic diseases out there and the medications that help to manage them, such as diabetes with insulin. For many, GLP-1 might be a chronic or lifelong therapy. Others may decide that this is not something that resonates with them and their journey. And so, strategies like dose de escalation or titration, as well as leaning back on their care team and those lifestyle interventions and healthy habits that they worked on developing, leaning back on those through maintenance is definitely a great scenario. Another great thing to consider as you're deciding what type of maintenance scenario is best for you is think about, were there any medications that you were able to discontinue because of your results with the GLP-1 medication? Maybe you were able to stop taking your cholesterol medication, or your blood pressures have been looking way better. So those are some other things to consider as you're trying to decide whether GLP-1 medication is something you want to continue throughout your life. So, what are some common maintenance scenarios for someone taking a GLP-1 medication? This can look like a lot of different things, and know that in every scenario, it's customized to you, your goals, your comfort level, and your medical history. You also are always going to have ongoing support from your care team. So, looking at some of those maintenance scenarios, someone taking a GLP-1 medication might decide to do that titration or a dose de escalation and transition over to a lifelong low dose therapy. So, taking a small dose to carry them through that maintenance phase. Someone might decide, hey, I feel really good. I don't have a lot of side effects. This is working for me. And so they might just decide to continue their regular dose throughout their life. Someone might decide to titrate down and then eventually stop their medication altogether, and then rely on those lifestyle habits that they worked on building throughout the program. Someone taking a GLP-1 might decide to stop the GLP-1 medication and then instead transition to what we would consider a core medication like bupropion, naltrexone, or metformin. Whereas others might decide to discontinue their GLP-1, but then have kind of that intervention weight range, maybe 3 to 5 pounds above their goal weight range, to re-engage their care team and see if maybe restarting a GLP-1 medication is necessary. So these are all some common maintenance scenarios. It's definitely not inclusive of every scenario. Start thinking about which one resonates the most with you, what's going to fit your lifestyle and goals best. And definitely this is something great to discuss with your clinician and your dietitian as you're considering this. There are so many nutrition topics you can discuss with your dietitian, many of which play a role in maintenance. And so definitely make sure that you have scheduled a visit with a dietitian if you haven't already done so, or reach out to them in the chat. You may want to talk about nutrition quality or portion sizes, food shopping, label reading. Maybe you want to focus on mindfulness or tuning into your body's hunger and fullness cues. You might want to talk about gut health, the microbiome, fiber targets, regularity. Maybe you want to talk about reducing certain nutrients in your diet or increasing them, such as minimizing saturated fats and adding in more healthy fats. Maybe you want to talk about your alcohol consumption or your sugar intake. You might want to talk about your eating patterns, like, are you skipping meals? Are you binging? Are you restricting? Do you have any specific cravings? Maybe you want to talk about managing sleep and stress and the impacts that this has on your body. You might also want to talk about hormonal changes, pregnancy, menopause. We always know that as humans moving through life, little blips are going to come up, stressful situations that are going to test us. Maybe there's family changes, like a new relationship, a divorce, a job change. Maybe you are planning on traveling or going on a vacation soon, and that's something you want to discuss. I know the holidays can be a big topic as well. Or maybe you just want to talk about cooking, some new skills or new recipes. That's one of my favorite things to talk to members about. So I love this slide. The first step to sustainable maintenance is healthy weight loss. So, losing weight at that healthy pace, as well as setting up a strong foundation of healthy, sustainable habits, like learning how to build a balanced meal that's satisfying and enjoyable, or incorporating exercise and mindful movement into your life early on in the process rather than waiting until you're getting close to your goal weight range is going to set you up for success long term. At Weight Watchers, we always believe that healthy eating should be realistic, flexible, and enjoyable because that's something that's going to carry you throughout life instead of it being a fad diet. Trying to move away from overly complicated diets or excessive restrictions and instead practicing that flexibility and grace. And then moving towards being consistent with the basics. Using the balance plate framework, you can see over on the left. We've got half of our plate filled up with non-starchy vegetables and fruits, providing lots of fiber, hydration, vitamins, minerals, phytochemicals. Your dietitian can definitely help you to find some more flavors within that category if that's something you would like to work on. Then a quarter of your plate being those lean proteins, keep your muscles and your bones strong, and another quarter of your plate being those energizing carbohydrate containing foods like breads, pastas, rice, all your grains fall into that category. So, as a registered dietitian, I always like to look at what the evidence says. And so, a systematic review of nearly 300 individuals who pursued weight loss showed that those with clear, personalized goals that were continuously reevaluated and adjusted helped with weight maintenance. So, setting those goals early on and then continuing to check in with yourself or maybe checking in with your dietitian on those goals instead of having just one set number on the scale that you're working towards. That's what's going to set you up for success long term. Also, having some coping mechanisms for those situations where life gets a little messy. A stressful situation, an emotional situation, those are going to happen to us. And so, being prepared in advance with a strong support system as well as some strategies is really important for long term maintenance as well. So, what are some behaviors of people who maintain their weight? They participate in strength training at least 2 times a week. They exercise 300 minutes of moderate intensity activity per week. They monitor their weight regularly, maybe once a week. They enjoy their diet, aka their way of eating, by honoring their preferences, cultures, flavors they like, and their lifestyle. They feel like they have flexibility within their life, so they're including their favorite foods. They enjoy fruits and vegetables, 5 to 9 servings per day. They prioritize protein to keep them full and keep them strong, having balanced meals. They eat most of their meals at home, limiting fast foods and eating out for those special occasions. They limit alcohol and sugar sweetened beverages. They maintain those social supports and long term contact with their care team. They feel as though they've made changes to their identity. Now I'm a person who eats well, or now I'm a person who likes activity. They navigate major life changes with grace without losing sight of weight maintenance goals. So, having those backup plans for when life gets messy. Pause the video and ask yourself, are there any areas of opportunity on your own journey to develop some of these behaviors? Who is your maintenance support system? Feel free to write these down. All right, last thing I'll make you write down today, I promise. This is our last activity. So pick a behavior from the previous slide. Maybe there's a habit or something you want to work on, or maybe it's something that's not on the slide, but it's been in the back of your mind. Think about something you're wanting to change in your life right now. What are the pros of making the change? What are the cons of making the change? Then think about what are the pros of not making the change? That one's a little different. And then think about what are the cons of not making the change. I'll show you some examples on the next slide, but feel free to pause here, write this down, and then we can regroup. All right, so one activity or behavior that I chose was increasing to 300 minutes of moderate intensity cardiovascular activity per week. This can definitely be challenging, especially if you're busy with kids, job, life gets in the way. But it's definitely a goal that I work on and many people are working on. So, what are the pros of making this change? Well, I do like to walk and I really enjoy being outside. It's a better chance for weight maintenance. I'll probably feel more energy, have more stamina, my heart's going to be healthy, and I'm going to get to tone up my legs. I'll also get to spend more time with my pets and my kids. Some cons of making the change are that, of course, it's going to take some time out of my day, and that's not always something I want to give up. Another con is it's kind of cold and snowy, and that's not always something I love to spend a lot of time outside in. What are some of the pros of not making this change? Well, I'll have more time to read, to work, to sleep, to crochet. The cons of not making this change, though, are I'm at risk for weight regain. And I probably won't have much energy. I might feel sluggish. Laying things out in this way is a really great visual for not only motivating you to work towards a new habit or behavior, but also determining what's going to get in the way, what's going to be my roadblock for actually making this change. And then start thinking up some solutions for how to make it easier to get over those roadblocks. That's how we can actually make changes that are sustainable and we're able to maintain. All right. So that is the end of today's presentation. I like to end it with this quote: never accept a small failure as a total defeat. So, getting rid of that all or nothing mindset. Small changes, small moments, as well as little blips in your habits and goals are totally normal, and you're still moving forward. I hope you enjoyed today's presentation. I hope you gained something from it. Be sure to reach out to your care team. Maybe you want to schedule a one-on-one visit with a dietitian to discuss this a little bit more. And we always appreciate your feedback, so please click the link to fill out a brief survey. Hope to see you at more group events and in the chat or at a visit, and I wish you well on the rest of your journey. Thank you so much. Bye.